Hello, everyone. My topic is smoking cessation programs and their effectiveness and challenges. So, an overview, this presentation will go over smoking cessation programs throughout the states of Illinois and Indiana, as well as national smoking cessation programs in the United States. It will also discuss what forms of interventions these programs use and how they are successful and effective for individuals. This presentation will also discuss the challenges that programs and individuals may face. So, just an overview of smoking cessation programs. Smoking cessation can be defined as the process of quitting or stopping smoking. Smoking affects a person's physical, mental, and emotional health and can cause great harm to one's body. Smoking is a global public health crisis. Individuals struggle to quit due to the highly addictive chemicals in e-cigarettes and cigarettes. Smoking cessation programs have the desired intent of supporting individuals in their journeys to stop smoking. Smoking cessation programs provide individuals with resources and to aid in their quitting journey. So, in the United States, over 49 million people use tobacco products, according to the Centers for Disease Control. Smoking tobacco leads to many health complications such as cancers, lung diseases, cardiovascular diseases, and many more. Every year, the United States spends billions of dollars treating diseases that are related to the use of tobacco products. Obviously, nicotine is a harmful chemical that is highly addictive, and it's found in all tobacco products such as cigars, cigarettes, and e-cigarettes. Because nicotine is a highly addictive chemical, it can change the way a person's brain thinks, making them have cravings for it. Some products, such as e-cigarettes, are designed to make nicotine delivered to the brain within seconds. This makes it easier for individuals to become addicted and be dependent on nicotine. Tobacco is the leading cause of death in the United States, and it has become the most preventable disease. In the United States, more than 490,000 people die from smoking or secondhand smoke each year. Smoking cessation programs in Illinois. So, in the state of Illinois, the Illinois Department of Public Health has a program named the Illinois Tobacco Quit Line. The Illinois Tobacco Quit Line is funded by IDPH and is operated by the American Lung Association. The partnership between the American Lung Association and the Illinois Department of Public Health was founded in 2001. This partnership allowed for the creation of a free cessation program to help service individuals who reside in the state of Illinois who are attempting to quit the use of tobacco products. The Illinois Tobacco Quit Line is a free service that individuals can enroll themselves or be referred to help in their journey to quitting the use of tobacco products. The program is for any individual aged 13 and older. The program offers 9 virtual counseling sessions for 6 weeks with certified staff members, as well as offering nicotine replacement therapy if needed. The Illinois Tobacco Quit Line has partnered with local health departments and other health care organizations to create a referral program. The referral program allows healthcare providers as well as public health officials to refer individuals to the Quit Line. Patients are more likely to quit the use of tobacco after brief discussions with medical staff. The referral can be made online, through an email to the Quit Line, or by electronic health records. The referral partner program is a great asset to healthcare staff because it allows for direct patient interactions. Smoking cessation programs in Indiana. In Indiana, the state offers a free smoking cessation program known as Quit Now Indiana. Quit Now Indiana is very similar to the Illinois Tobacco Quit Line. In Indiana, anyone over the age of 13 is eligible for the program. Like Illinois, Indiana offers over-the-phone counseling with a quit plan that meets the patient's desired needs and wants. The Indiana Quit Now program is just like the Illinois Tobacco Quit Line, providing the same services. Another cessation program offered in Indiana is through IU Health Bloomington Hospital. The program is called Beat Tobacco and was designed to educate and support individuals on how they can be tobacco-free. The Beat Tobacco program is free to individuals and offers an array of interventions such as tobacco counseling, education, pharmacotherapy, and referrals to specialists. The program offers in-person classes as well as over-the-phone consultations. Other programs offered throughout the United States. I just want to note that there are way more than this, but I chose to focus on just these 2. So in the United States, there are many smoking cessation programs to help individuals who are ready to fight the hard fight to quit smoking. The United States has many smoking cessation programs to try to meet the needs of every individual. The phone number 1-800-QUIT-NOW is the national network that lists different quit lines in each of the 50 states. Quit lines, first launched in 2004, made it easier for public health professionals to promote their specific state's quit line and start streaming tobacco education media campaigns nationwide. Throughout the years, the National Quit Line has developed traits to meet the needs of all of its clients. The national number offers texting services, phone call services, online chats, and apps. The National Quit Line developed a national line offered in different languages to help meet the needs of those whose primary language is not English. Another smoking cessation program in the United States that has effective rates is the Empowered to Quit through the American Cancer Society. Empowered to Quit is an email-based program that helps individuals set a quit date while managing their cravings and help regulating their withdrawal symptoms. Each day, the program sends out empowering emails designed specifically for their patients. So, successes through interventions. So, there's pharmacological therapy, behavior therapy, combination therapy, and healthy lifestyles. Pharmacology therapy allows individuals in smoking cessation programs to have the access to nicotine replacement therapies, which help alleviate nicotine withdrawal symptoms and cravings. Through the Illinois Tobacco Quit Line, individuals can qualify for nicotine replacement therapy. To qualify, individuals must be enrolled in the program at least the age of 18, be medically cleared, and have limited to no health insurance coverage. The Food and Drug Administration has approved 5 nicotine replacement products. Products that are offered through the Quit Line and other smoking cessation programs in the United States are gum, patches, nasal sprays, inhalers, and a few others. So many individuals ask the question, what is nicotine replacement therapy and how does it help patients who are trying to quit the use of tobacco products? So nicotine replacement therapy can be defined as a medically proven way to help tobacco users quit. Nicotine replacement therapy gives patients small amounts of nicotine through patches that are placed on the skin, gum, and many others. Nicotine replacement therapy is provided to patients because it does not have the hundreds of harsh chemicals that e-cigarettes and cigarettes contain. Symptoms of nicotine withdrawal can include, but are not limited to nausea, irritability, feeling hungrier than normal, headaches, strong cravings, insomnia, etc. This form of therapy allows patients to feel less uncomfortable in nicotine withdrawal, but will not fully make patients feel better instantly. Nicotine replacement therapy is recommended to last from 6 to 12 weeks. Nicotine replacement therapy increases one's ability to stop the usage of tobacco products by 50%. The benefits of nicotine replacement therapy have helped many individuals who struggle with their addiction. So, behavior therapy. All smoking cessation programs offer a form of behavior therapy. Through a Quit Line or other smoking cessation programs, individuals can interact with others going through the program. Behavior therapy helps individuals facilitate smoking cessation, provides clients with coping skills, and helps reconstruct maladaptive thoughts. For example, the Illinois Tobacco Quit Line uses one-on-one counseling methods to help meet the specific needs of their clients. The program created by the American Lung Association, known as Empowered to Quit, hosts group counseling classes throughout the United States. Behavior therapy allows individuals to connect directly with certified behavior therapists. Most smoking cessation programs that offer behavior therapy offer individuals a way to cope with being tobacco-free. These methods are different for every program, but some behavior therapies can include motivational interviewing and incentives to help motive and reinforce the behavior change of individuals in the program. In a study, over 35% of individuals who enroll in behavior therapy report that they were successful in quitting tobacco products. It is important to realize that behavior therapy is not going to help every individual who goes through a smoking cessation program, but it is a result of why many smoking cessation programs offer more than just behavior therapies. Combination therapy. So combination therapy is the most effective intervention for a smoking cessation program. Combination therapy is the therapy that involves the combination of pharmacology and counseling. It is recommending that smokers use a combination therapy that has 2 different forms of nicotine replacement therapy, such as nicotine gum plus a nicotine pouch, or therapy with 2 forms of medication that have different therapeutic targets. Combination therapy allows medical providers or counseling experts to provide individuals with medication that have distinct mechanisms. Combining different nicotine replacement therapies provides stable, minimum baseline levels of nicotine being released with the potential to increase levels through different forms of therapy in response to the individual's withdrawal symptoms. Combination therapy offers individuals advantages at increased rates of abstinence and increased rates of enhancing withdrawal symptoms. Versenline is the most effective for smoking cessation because it blocks the nicotine receptors in one's brain. Versenline is a nicotine monotherapy prescription pill that is prescribed to help adults quit smoking, and it can be combined with a nicotine patch to help alleviate withdrawal and craving symptoms that happen within the first 2 weeks of individuals trying to quit. To continue, combination therapy includes pharmacology entities as well as providing counseling services. Counseling is completed by a certified counselor who is assigned to individuals or groups to help them meet their desired needs. Combination therapy can last up to 24 weeks, but be as low as 12 weeks. Certified counselors focus on supporting individuals with coping strategies, ways to maintain positive thoughts, ways to recognize their triggers, and many more. Combination therapy is most beneficial for those who are heavy smokers, who have a high chance of relapsing, or those who have relapsed many times before. And healthy lifestyles. So, smoking cessation programs aim to create a smoke-free environment worldwide. There are numerous benefits once individuals quit using tobacco products. Those who stop using tobacco will notice an increase in their appetite, changes in their mood, and are at a reduced risk for 12 types of cancers. Following the cessation of smoking, the body immediately begins the healing process. Within the first 30 minutes after quitting tobacco, a person's heart rate and blood pressure will start to return to normal levels. After 14 hours without nicotine, the carbon monoxide level in the blood decreases. As carbon monoxide levels drop, oxygen can be carried more efficiently throughout the body to reach the blood vessels and the tissues. Within 2 weeks of quitting tobacco, a person should be able to exercise without getting winded. Quitting tobacco products enables individuals to lead a healthy lifestyle and encourages them to promote health and wellness. By giving up tobacco, individuals significantly reduce the risk for diseases like coronary heart disease and 12 different types of cancers. Long-term benefits of quitting can also include lowering the risk of secondhand smoke exposure for those around them. Secondhand smoke results in over 34,000 deaths each year. So, what are the challenges of smoking cessation programs? That can include nicotine replacement therapies, triggers, so emotional, social, pattern, and withdrawals, and health issues. Nicotine replacement therapy. There are many benefits of smoking cessation programs, as they help 1 in 10 people to quit the use of tobacco products. Although many people benefit from smoking cessation programs, many challenges arise. Nicotine replacement therapy is an option that can be free to individuals, but it can make patients experience side effects. Side effects of nicotine replacement therapy can include gastrointestinal symptoms, central nervous system symptoms, and many more. Individuals can experience neuropsychotic symptoms that can lead to depression and anxiety, increased dizziness, and vivid dreams. Because nicotine replacement therapy is relatively new, individuals should follow up with their primary care physicians. Symptoms of nicotine replacement therapy can lead to other health conditions, and this can be a challenge for many people, especially if they are under or uninsured. Medical bills can be stressful for many individuals, so if they are struggling with nicotine replacement therapy pharmaceuticals, this can cause resentment toward treatments and can cause them to drop out of their programs. Another challenge is triggers. Another challenge that individuals could face when in smoking cessation program is triggers. Individuals who smoke for years and then quit might experience triggers. Triggers can be defined as something that encourages and makes someone want to start smoking again. There are emotional, social, pattern, and withdrawal triggers. Emotional triggers can affect a person who might be feeling upset or happy. These types of triggers are the most common among individuals who smoke. Smoking might help individuals in the exact moment, but the feeling will only last for a few minutes. Individuals need to recognize their emotional triggers and find coping methods that will work for them. Emotional triggers can be daunting for those who have quit smoking. Emotional triggers can be defined as anything that includes memories, experiences, trauma, or something that initiates an intense emotional reaction. It is important to realize that triggers can have different emotions attached to them, such as happy, sad, angry, satisfied, etc. The biggest emotional trigger for those who have completely given up nicotine is seeing someone with an e-cigarette or a cigarette. The smells of these products can be an emotional trigger for many people. Individuals must recognize their triggers so that they can cope with them in the best ways that suit their needs. Quitline's programs across the United States are helping individuals learn coping skills as well as identifying their triggers during their counseling sessions. So what about social triggers? Social triggers can be defined as triggers that individuals associate with other individuals who use tobacco products. Social triggers can be daunting because over 28 million people in the United States smoke some form of tobacco products. Social gathering can bring triggers because of other people using the products that you are craving. Individuals need to ask their peers not to use tobacco products in front of them or address their concerns with the management supervisors of the companies. So that's basically at the workplace and in public places. In the state of Illinois and Indiana, it is a law that smoking must take place 15 feet from all entrances of public businesses. Coping with social triggers can be challenging because smoking constantly happens when individuals are in social situations. Because nicotine is a highly addictive chemical, withdrawal symptoms and triggers can be a challenging factor in one's journey to quit. Withdrawal symptoms normally happen within 3 days of quitting the use of all tobacco products. Symptoms of withdrawal can include, but are not limited to, craving the taste, fidgeting with the hands and fingers, needing to handle a lighter, you might be feeling more fatigued, and etc. Nicotine replacement therapies can help individuals deal with withdrawal symptoms after they have quit smoking. Health issues. So individuals who smoke may see their overall health and well-being deteriorate over time. Smoking can cause serious health conditions in one's body. Serious medical conditions such as cancer, lung diseases, vision problems, diabetes, heart diseases, and an increased risk for coronary heart disease. Treating medical conditions of serious matters such as lung diseases can be extremely expensive for many individuals. Medical conditions that are caused by smoking can be challenging for the patient and the medical provider because of insurance barriers and the patient not wanting to fully give up smoking. Over 10.9%, or 33 million Americans, do not have health insurance. If a patient does not have adequate insurance, then they may not seek medical attention due to the financial burden that it may cost for them. When letting serious medical conditions go, patients have a hard time recovering and ultimately resulting in death. Another challenging aspect of health issues can be influenced by the patient if they refuse to try to quit smoking. Often, medical providers encourage and refer their patients to a smoking cessation program. Some medical providers will refuse to treat patients who are long-term smokers because of evidence-based reasons, and many smokers who undergo medical procedures have worse outcomes compared to individuals who do not smoke. So the methodology and results. This paper presentation aims to highlight smoking cessation programs in 2 states and across the United States. Each state in the United States offers a free tobacco cessation program for its residents. It is important to highlight that quitting the use of tobacco can be very challenging and bring many hardships to the individual's journey. Because no two people have the same journey, smoking cessation programs aim to offer the same goal but bring different services to the table for all individuals. The result from the extensive research suggests that smoking cessation programs are effective in helping individuals across the United States completely quit all use of tobacco products. Smoking cessation programs have many benefits for individuals, and their success rates are continuing to grow each year. Nicotine replacement therapy and combination therapy benefit many individuals due to the extensive treatment from board-certified medical professionals and counselors. Group therapy sessions allow individuals to connect with others in their area who are also in the fight to quit their addiction. Group therapy allows individuals to connect, discuss, and not feel isolated in their journey. The research also suggests that there are many challenges that smoking cessation problems face. If individuals are not ready to quit, their journey could be started and stopped many times. There are also many triggers that individuals may face due to several reasons. Smoking cessation programs are working towards eliminating challenges that individuals face and are striving towards creating an environment that meets the needs of every individual that goes through these programs. Conclusion. Smoking cessation programs are valuable in creating a smoke-free environment across the United States. There are 50 programs across each of the 50 states that serve individuals at no cost. The benefits of smoking cessation programs is that there is no cost, allowing individuals not to be scared of having medical bills and to put themselves under a financial burden. Since the early 2000s, smoking cessation programs have helped millions of people quit their journey with tobacco products. Smoking cessation programs offer many great interventions such as nicotine replacement therapies, combination therapies, and access to certified mental health therapists. Interventions such as those listed above are crucial in one's journey to quit. The Illinois Tobacco Quit Line is a great resource for individuals in the state of Illinois to receive help in their journey in quitting tobacco. As stated earlier, this program is free to any Illinois resident aged 13 and older. The Illinois Tobacco Quit Line has seen great results from their program and is working towards creating a smoke-free environment for all Illinois residents. Like Illinois, the state of Indiana also offers a tobacco cessation program for anyone 13 years and older. Each state is working toward creating a tobacco-free environment while ensuring that all of their clients have successful journeys. There are many smoking cessation programs throughout the United States, and while they all differ in services, they all are working towards the same goal: creating a smoke-free environment for all. The successes of these programs have made major strides in addressing the national and global tobacco crisis. Although it may take many years for our country to be smoke-free, smoking cessation programs are putting in the hard work to encourage all tobacco users to end their journeys and start living a healthier lifestyle.